Usually what I do when I'm in a group is I'll ask about dentists and how many people have ever had braces or retainers. And usually there's somebody in the group that will raise their hand and we'll ask how long that they've had those, or how long do you normally have to have a set of braces. And usually the answer is between a year and 4 years. Sometimes it's outside that spectrum. Usually the concept though is in there, and it says it takes a few years to change the teeth. And that's one of the things that you have to understand relative to the human body is in chiropractic care, what I'm trying to do is relatively close to what dentists are trying to do. We're trying to help align something. The difference is your body wants your spine lined up because the nerve system, when there's pressure on it, it's distorting life and giving some expression that's not normal. So what I have in my advantage is, compared to dentists, is I have the body trying to actively correct it as I help it. The disadvantage I have that dentists don't is I cannot brace your spine because that would be counterproductive. Motion is life. We have to let it move. We also have to get it back where it's supposed to be. Ligaments, tendons, and bones all have to heal and change. And in that perspective, we understand that there's time involved. Because of that, if you think in the beginning from a treatment perspective that I'm going to treat this symptom and get out of a hole, you're going to miss the big idea that this actually is not a treatment of a symptom. Not only that, there's laws in the body that it's going to take time to not just get your spine more lined up, but also to try and create an opportunity for it to stay there, which includes changing the ligaments, the tendons, the bone, reshaping what's happening in there, and the body actively does that itself, and then reprogramming your brain so that way it can hold the adjustments. That takes time. So what I usually recommend, depending on each case, for the average person that I see coming in, usually it's going to be about a year plan. And towards the end, you're coming in less frequently. In the beginning, you're coming more frequently, and depending on what is going on with you, it's going to be more or less. So I wanted you to hear this from the beginning so you understand that chiropractic used correctly is not a treatment of a symptom, and it's not a treatment at all. It's actually a lifestyle, and when you use it for maybe a year to get yourself out of the hole, eventually you get to a point where you're going to use it for a healthy lifestyle, just maintaining what we got or continuing to improve it, and that's at a cycle that resonates with your body and whether or not you hold your adjustments. And going back to the concept, it is not me and it is not you that dictates your care plan. It is whether or not you hold your adjustment. If you're in adjustment, there is no point in getting adjusted. Chiropractic does not improve on the human body. We just remove interference to it. So when you have no interference, there's nothing more I can do until it goes back out. So I recommend getting checked regularly, depending on how long you hold. So if you hold your adjustment for a couple months, you're probably safe at getting checked every couple months. That is not something people start out with though. You want to get there and you want to get yourself out of all the stuff that you've been through throughout your life. You want to get to a point where now I'm starting to hold. But initially it's going to take a little bit of time. Just roll up your sleeves and do it right. Another question I have, would you rather do patch care or would you rather do corrective care? If I could get you near normal or right, or more importantly, more correctly, if your body could get you near normal and right, would that be something that you're interested? Or do you just want to feel better for now and just patch it? It's kind of like a road. If there's you ever seen a road that has a pothole? That pothole, you can take care of it a couple different ways. It's more time consuming, more expensive, more involved, and more of an investment rather, to do it right and just clear that road, take out all the potholes and then repave it. That's going to last longer. Or you could just, for the time being, cut out the hole and put a patch there, and then later come back and realize that that's not going to keep it right, and eventually it's going to start to create a divot again because it wasn't done correctly. That is the same analogy I use when I'm asking a group of people, how would you like to take care of this? Do you want to just patch it for now? Because it's your body, and I respect that, and I'll help you to what degree you want help. I got to know from the beginning where we're both headed. Because if you tell me you're headed here, I can help you there. My suggestion for you, look at it, sleep on it, and think about it, because there's no better life expression, no better chance for you to do what you love than having a clear, free, interference-free body.